Will exercise affect how we sleep? And will a lack of sleep affect our ability to exercise? Stay tuned to find out. Sleep is a physiological process that is essential for our survival. And in our lifetime, we will spend about a third of it asleep. During sleep, there are several processes that occur that help to store new memories, clear the brain of toxic chemicals, allow nerve cell reorganisation, and allow the rest of the body to repair, store energy, and release hormones and proteins. These processes only happen during sleep. The most anyone has ever gone without sleep is 11 days. But they become psychologically disturbed by hallucinations, had difficulty concentrating and forming short-term memories, and became extremely uncoordinated. Basically, sleeping is good for you, not sleeping, very bad. There are 4 main stages of sleep, and we cycle through them many times throughout the night. Of the 4 stages, the first 3 are non-rapid eye movement sleep, otherwise known as REM. They mark a deepening of the sleep. But it is during deep sleep that the majority of the restorative work occurs. Cerebrospinal fluid flows through the lymphatic system in your brain, flushing out the detritus that has accumulated during the day. The pituitary gland secretes growth hormone, which is vital for cell growth and repair, which is why injured patients tend to sleep a lot. There is also an increased growth and maintenance in the immune, nervous, muscle and skeletal system. The metabolic rate decreases, promoting energy conservation. And melatonin is released from the pineal gland in the brain to mop up the free radical reactive oxygen species, which are byproducts that can be harmful if left to accumulate. During deep sleep, important memories are shifted from the hippocampus to the safety of the prefrontal cortex. Anything left in the hippocampus is gradually deleted. Without deep sleep, memories are not moved and will degrade in the hippocampus, and that is why short-term memory is affected. Glycogen stores that were depleted during wakefulness are restored during deep sleep, making sure that the powerful brain processes has the energy ready on hand. The final and 4th stage of sleep is REM sleep. It first occurs about 90 minutes after falling asleep and is characterised by the eyes starting to move beneath the eyelids. Brain activity starts to increase again, as does our breathing rate and our heart rate. It is this point during sleep we are at our most rousable and we have those very vivid dreams. Typically, this stage tends to last around about 10 minutes. Those 4 stages will repeat in 90 to 120 minute cycles, with longer periods of deep sleep earlier on in the night, with more periods of REM sleep in the early hours. You may wake around these points but not realise until the morning. There are various molecules in the body that either promote or inhibit sleep. Leptin, a satiety signal, and adenosine, a byproduct of various processes, actively promote the effect of sleepiness. Caffeine is an adenosine receptor blocker, which is why caffeine can reduce the feelings of sleepiness. Orexogens and histamine stimulate the release of neurotransmitters such as acetylcholine, noradrenaline, serotonin and dopamine, which actively promote and maintain wakefulness. Ghrelin, the hunger hormone, has an inhibitory action on sleep, so if you're hungry, sleep might be difficult to come by. Antihistamines inhibit the histamine neurons, reducing the wakefulness effects, thus they cause drowsiness. As I briefly mentioned in my last video, a lack of sleep induces fatigue. However, acute or chronic lack of sleep seems to have minimal effect on athletic performance. But the perceived exertion of those activities were greater. Instead, the greatest effects due to sleep loss have been seen in the rate of exercise-induced injuries. Sleeping for less than 6 hours a night has been considered to be an independent risk factor for injuries obtained during exercise. This quite possibly could be linked to a decrease in proprioception, postural control and reaction time, making it quite likely that it's a neurological deficit that is the culprit. Once injured, sleep loss can impair the functional recovery of the muscles. Sleep deprivation downregulates the protein synthesis that repair muscle damage and contractile function deficits. Growth hormone is a major factor inducing the repair of muscles, and during sleep it is released in larger amounts so the tissues can repair. These larger amounts of growth hormone stimulates a greater rate of repair during sleep. The prolonged injury recovery has been shown to affect sleep quality due to pain, resulting in a pernicious cycle of sleep loss, injury, decreased recovery patterns, increased pain that increases sleep disturbances, and so on and so on and so on. Sleep disturbance can increase the risk of overtraining during high volume training periods, within which the risk of obtaining an upper respiratory tract infection is higher than in comparison with normal training loads. A lack of sleep has also been shown to reduce the adaptive response to adjusting to hot and cold climates, therefore reducing your physical performance in these situations. To summarise, although there is no definite evidence to show that sleep restriction affects exercise performance, there is strong evidence to show that lack of sleep can increase your risk of injury, decrease recovery time for that injury, increase risk of becoming unwell, and decrease your ability to respond to hot and cold climates. To put it very simply, yes, but there are several factors to consider when planning your exercise. Is it a one-off? Is it regular? Aerobic or anaerobic? What is the intensity, the duration or time of day? Where are you doing it? Also to consider is your own background and lifestyle. Are you already achieving the minimum amount of sleep that's recommended? Are you overweight? When do you eat? Have you decided to quickly go down the pub and have a pint? The list of variables is endless. At the moment, there is no evidence to support an ideal time of day to exercise that would help improve your sleep duration or quality. However, it has been shown time and time again that regular 30-minute bouts of moderate intensity exercise day to day can help improve your time spent in deep sleep, increase total sleep time, decrease REM sleep, and decrease time spent getting to sleep. But if you're already exercising regularly and still having trouble sleeping, it might be worthwhile investigating what is causing you to stay awake. There are many external factors that can influence our ability to sleep. This can include stress, alcohol or drugs, including medications, caffeine, the time we eat, what we eat, pain, anxiety or depression, our sleep environment, or even our work pattern, such as shift work. As a previous shift worker, I can tell you that my sleep hugely suffered from the constant change in work pattern. I would go to sleep after a 12-hour shift at 6:30 or 7 in the morning, and then struggle to sleep beyond midday, often waking every hour or two. As someone who can pretty much fall asleep anywhere, but frequently wakes up 2 to 3 times in the night to go pee, I'm probably not the best to advise. However, I have found that by reading the book Fast Asleep by Dr. Michael Mosley has summarised the tips that I have tried over the years. I have no affiliation with the book, I just found it a great resource that collated all the supporting evidence well. Just one small caveat to the book. I do not support at all buying medications online unless it is being prescribed to you by your GP or family physician. There is a reason melatonin requires a drug licence in the UK, as it is medicinal by function. You should always speak to a medical professional before you start taking any new medications. Over the years, I have found the main factors that have helped me get good quality sleep are the following. Make your sleep environment just for sleeping. Go to sleep at regular times and get out of bed at a consistent time. No lie-ins. Wind down before bed. This can include relaxation exercise such as yoga, reading a book or watching TV, writing a to-do list for the following day to clear your mind, and avoid going on social media. Too much drama and brain stimulation there. I personally keep a journal, and in this I use it to summarise my day and to put down any thoughts that I might ruminate over in order to prevent me from doing so while in bed. I also try to be in bed about an hour before I plan to go to sleep, as this helps me to wind down and shut out the world, and it also means that I actually associate my bed with sleep rather than just being in a place to relax. For some, the following might not be recommended, as it can actually cause their brain to become more active. However, for me, I find it helps drown out the little voices in my head that can cause me to ruminate, and that's watching some YouTube videos or to fall asleep to BBC Radio or a podcast, but I keep the volume very, very low, to the point where I can barely hear it, so I have to concentrate. I'll finish off with my personal take on sleep and exercise. I personally find it easier to fall asleep if I've done some activity during the day, whether this is walking, running, cycling, HIIT, or any sort of just activity, as long as I've got myself moving. On the days that I move very little, or my mulch days as I like to call them, I actually find it takes me longer to get to sleep and my sleep quality actually decreases. So if you're already getting some level of activity in your life and are still struggling with your sleep, it might be worth looking at other factors apart from exercise. thank you for watching this video on sleep and exercise. I hope you've enjoyed it. Remember to get in contact with your GP or family physician if you have a medical condition and wanting to get into exercise. If you enjoyed this video, don't forget to like, subscribe and ding that bell if you want to be the first to know when the next video drops. Speaking of which, the next video will be on hypothermia and exercise. Again, thank you for watching and I'll see you next time on FitMed.